Good evening to everybody. Welcome to another edition of Libertas. This is Tonino Abana. With our special guest for tonight, we have Dr. Ruben Encarnacion, who will join us and who will give his expert opinion on mental health in the Philippines. Dr. Encarnacion is a clinical psychologist and he's been a guest of this show in the past. So many questions in the previous episode that we had with Dr. Encarnacion and Dr. Sevilla. So we requested Dr. Encarnacion to come back so that we can just focus on mental health. Good evening.
Hey, good evening. Thank you for guesting me again.
Okay. What are the main issues facing the Philippines with regards to mental health, Dr. Encarnacion? Ano ba yung mga kadalasan na nagiging problema ng ating mga mamamayan sa pagharap ng yung mga problema sa pag-iisip?
The most common problems are depression and anxiety, especially among young people. You hear about teenage depression as early as 16, 18, and in a study on this social demographic, students from Ateneo, LaSalle, UP, FEU, UE, UST, the number one reason they say why they get depressed and anxious, even suicidal, is academic pressure. The close second is family problems and relationship issues. Yun yung sa demographic na yon. For less fortunate people naman, lower in the demographic, yung mga teenage pregnancy, and then the boy leaves the girl, no? Na ina-abandon yung babae, yon, mga suicide risk yung mga yan.
So, okay, parang apat yung nadinig ko na issues. Yung isa yung anxiety tsaka depression. Pag-usapan natin yun, ano bang kaibahan ng dalawang yun. Tapos, may binanggit kayo na pagkakaiba between the lower strata of society and the upper strata of society. So, siguro, para maintindihan ng ating mga viewers, what's the difference po between anxiety and depression? Anong kaibahan nun?
Depression is matinding kalungkutan.
Oh, yun.
Feeling lonely, hopeless, feeling low, unable to get out of bed, unable to go to work or to school, losing interest in your normal hobbies, the things that make you happy, nawawala yung interest mo sa mga bagay na yon. You feel cut off from people, hindi ka makasocialize, wala kang gana sa buhay. You lose your ambition, you lose your drive. That's depression. Anxiety, beneath every anxiety, let it be said, no? Beneath every anxiety is a depression. You don't get anxious without an underlying depression. But anxiety manifests more in sweaty palms, heart palpitations, not being able to sleep, okay, because you fear that tomorrow, you don't want tomorrow to come, you wake up at 3 a.m., you can't sleep anymore, you're thinking, no? Over rumination, ganyan.
So, sobrang pag-iintindi.
Nag-worry. Tsaka yung parang pessimistic palagi. Parang walang kalalabasang maganda o mabuti kinabukasan, nothing to look forward to. And invariably, their reason for feeling anxious or depressed is they're unhappy with their lives, unhappy in their student life, no? Not necessarily just grades, but with their relationships and their boyfriend, their girlfriend. Tapos working people, young working people who are out into their first, second, third jobs na they cannot seem to find their stride at work. Hindi sila masaya sa trabaho nila. So they have really, they drag themselves to work, they get depressed, they get anxious. Naku, ang hirap, no? Ang hirap.
So, kanina nabanggit ninyo, Doc, yung kaibahan between yung nasa higher end ng society and the lower end. Yung sa higher end, yung pressure at school, they go to difficult schools. Hindi rin ba nararamdaman ng mga people in the public schools yan, yung mga ganyang klaseng anxiety and depression?
Una, sa rural, kung nasa probinsya ka, you're closer to nature eh. So, mas tanggap mo yung seasons, mas tanggap mo na may, dry season, mainit ngayon, mas malapit ka sa nature, which makes you more resilient. Tsaka tahimik lang buhay doon eh. Mabagal lang ang pace doon.
So may kaibahan din pala yung environment between the rural and the
urban. The mental health professionals are in the city. namely Metro Manila. Kung nasa probinsya ka, may problema ka. Kung magka-depression anxiety ka, you have difficulty accessing a mental health professional.
So is it a fact na people in the rural areas, kids in the rural areas can cope better with life because they have a better environment, the pressure is not too heavy?
Psychologically, yes.
Psychologically,
Ang problema nila materially, no? Kasi mas mababa income levels doon, mas mahina ang trabaho ng tatay nila, tsaka sila, yung prospects nila for the future, and the quality of their education, yun, aasa sila, lalo na kung matalino sila, puntang Maynila, no? The great Filipino dream from the provinces is to migrate to Manila and study there and find a job there. Yan na yung, mabanggit ko lang, yan na yung isang benefit sana ng federalism, no? Kung may urban centers tayo sa Cebu, Davao, Cagayan de Oro, Jensan, Iloilo, kung may urban centers tayo, may employment sana doon. A viable export processing zone, a viable commercial system, commercial business district, para may trabaho sana doon. Yun, nabanggit ko lang.
So, nabanggit natin yung depression, yung anxiety, yung pressure. How important is the role? Kasi mostly pinag-usapan natin yung kabataan, no? Yung mga problema ng kabataan. How important is the role of the parents dito sa pag-iwas din sa problema ng depression and anxiety?
Alam mo, sa experience ko with my patient load, no? A large, significant majority, 98 to 99%, sorry to say, always nakaugat sa parents. I do not want to blame parents kasi well-meaning naman yung mga yon, most of the time, ignorance, no? They don't know how to love their children effectively. Pero yung mga nadidepressed na anxious, talagang parents, you know? You'll be surprised. I have several.
You mentioned something, they don't know how to love their children.
Surprising yung mga depressed ko. Yung depressed ko from 21 to 26, kabataan, iba 18, 19, no? When I interview them first session, ay nako, pakikwentuhan ko sa kanila yung childhood nila, childhood experiences. It's really shocking, no, to find out that some young people have no experience of having been loved by their parents. Nakakagulat, no? Parang, bakit pa nagmagulang yung mga yun? Hindi naman nila minahal yung anak nila. And
baka naman may problema din yung parents na gano'n. Yung parents nila, hindi rin sila minahal.
Exactly.
Pero hindi kaya, dahil
observation. Exactly.
Kasi, kunyari, hindi ka minahal ng parent mo, hindi ka ba magbabago para yung anak mo, mahalin mo rin.
Oo, sana, no? That's what we are called upon, eh. We have to be better than our parents ever were.
Right.
No? Evolution yan, eh. We always have to be better than what our father and mother was. Pero kung matindi rin yung parenting mo, kung yung parents mo, medyo pinabayaan ka rin, o medyo nagkamali rin, in those simple days, in the 50s and 60s, parents mo, nagkaroon ng certain family mistakes, no? Hindi mo sila masisisi. Masisisi mo na, they did not, grow out of it. They did not realize that they made mistakes.
Do you normally call for the parents if you feel that there's a problem? Because normally magpapatingin sa inyo yung anak, di ba? Pero pag nakita nyo may problema yung parents, sinasama nyo ba sa counseling yung parents?
Rule of thumb is pag 18 and below,
okay,
tawagin mo yung parents. Dapat. Pero pag above 18 na, you work with that adolescent, young adult, to cope with his environment, to adjust better to the kind of parents he has. Hindi mo na mababago yung parents niya, eh. Unless below 18 sila, humihingi pa ng payo yon yung parents. Pero pag above 18 na yung bata, hindi na bata, no? Hindi mo na maano, eh. The arena is how they feel about things, how they think about things. You cannot change anymore what they are facing. So it's what they think about things that you need to change.
Wow.
In cognitive behavioral therapy.
We're going to go for a break, but before we go for a break, we'd like to ask Dr. Encarnacion this question. Keep it hanging until you come back. When is a mental health problem considered hereditary, and when is it because of circumstance? This is Tonino Abana. Please don't go away. Welcome back to Libertas. This is Tonino Abana with our special guest, Dr. Ruben Encarnacion, who's a clinical psychologist. Our topic for tonight is mental health. Before the break, tinanong natin si Doc Encarnacion kung kailan ba ang problema considered hereditary at kailan yung out of circumstance lang. Doc?
Yeah, that's a very good question. No? Certain events, practices, even attitudes tend to run in families. No? In terms of illnesses, yung mga depression, anxiety, somatic symptom disorder, schizophrenia, even, those tend to run in families. And there is a genetic loading, no? Na masasabi natin hereditary. Parang yung family history ng cancer, diabetes, hypertension, yon. They follow those lines. More subtly, however, things tend to run in families like separation, womanizing, alcoholism,
when you
gambling.
when you say it's not hereditary, but
No, it's not. It's
how do you describe that?
parang kunyari, separation.
Okay.
No? If you belong to a family na walang nag-separate, no? There is a strong taboo na you must not separate.
Okay.
Once a family member separates, it opens the floodgates
Ganun
for the
pala
rest
yun.
of the clan.
Oh.
It becomes a viable option. It's acceptable as a legitimate solution to marital stress na talagang hindi kaya. Okay. Dati kasi in the 60s, 70s, wala namang annulment eh. Wala namang separation. You grin and bear it, no? Di kayo magkasundo.
Parang middle ground dito, Doc, kasi
Yes,
yung isa, tinanong ko kung ano yung hereditary. Hereditary, yung mga schizophrenia, yung ito naman yung middle ground, yung it runs in the family, but it's not really hereditary. It's just a circumstance that runs in the family.
Womanizing. Kung yung father mo, grandfather mo, nangaliwa, no? Nag-chicks, nag-anak sa labas, there is a
possibility. But it's possible naman na maging straight din yung
Of course.
anak.
It's a matter of volition and will. No? Lahat tayo may willfulness and intentionality.
Because of example?
Of course. Parang may president, ba?
Okay.
May president in our family history na lolo natin, ganon. So parang ganon eh. It's a legitimate expression of one's virility. Okay. Especially if you're not so reflective, no? Hindi mo gusto baguhin yung pinagdaanan mo. You tend to be more of a victim than a change agent, an active agent of your life.
So, kunyari, yung sa kabataan pala, pagkapipili sila ng lifelong partner, titignan mo yung mga magulang at yung pamilya kung may history ng separation.
Kaya sinasabi natin na it's good to have to inspect. Sabi nga ng iba, kung mag-aasawa ka, ikaw yung lalaki, siya yung babae, the woman daw, the girl, should examine how the boy acts towards his mother.
In what respect?
Kung ginagalang niya yung mother niya, mabait siya sa mother niya, that's how we will treat the important women in his life.
Okay.
So, ganun daw.
Napaka, magandang advice yun for all our televiewers.
On a genetic sense naman, yung buhok ng magiging mister mo, yung hair kasi is passed through the Y genetic link.
Okay.
So, yung tatay ng nanay, the maternal grandfather's hair will be the model of your children's hair. Kumbaga ikaw, yung wife mo, yung father ng wife mo, ganun ang magiging buhok ng mga anak mo.
Ganun pala yun.
Kung kalbo yung biyenan mo, makakalbo yung mga anak mo.
So, hindi pala necessarily yung tatay?
Hindi, yung tatay ng misis mo.
Tatay ng misis mo ang magdadala ng buhok.
Ang magdadala ng buhok.
So marami tayong natutunan. So importante yung parenting, for the mental health of the kids. A big portion is actually the parenting because number one is really the parent needs to love the children. Yung lack of love o yung lack of expression of love, dun nagkakaproblema. Yun ang natutunan ko sa inyo sa first segment. Ngayon naman, yung sa circumstances, meron palang mga circumstances within a family na nagiging bunga ng kung ano pang magiging attitude ng mga anak.
Pwede magdagdag?
Of course.
Another important thing that I've observed, and it appears in studies as well, the compatibility ninyong mag-asawa, no? Depends a lot on how peaceful your parents' marriage was. Children of tumultuous marriages, much more separation. Children of separated parents, tatlong reaction yan eh. Number one, ng children below 18. Number one, they tend to blame themselves. Na may ginawa akong masama, kaya umalis si daddy dahil sa akin. Number two, they wish until their 60s, 70s that their parents one day will get back together and reconcile. No, it's an unconscious wish. They're not able to really move on. Hanggang 70 years old sila, umaasa pa rin sila na magbabalikan magulang nila. Number three, kasi ganun yung modeling nila sa bahay. That's how man and wife interact. No? Tumultuous, away ng away, hindi magkasundo. They tend to master that. They tend to repeat that in their own relationships.
Wow.
By having troublesome relationships themselves. Parang gusto nila sabihin, hindi kinaya ng parents ko, ako kakayanin ko. Hindi nila alam, hindi nila namulatan yung peaceful relationship na magkasundo. Okay, so kung peaceful ang parents mo, ayun, ang laking plus sa'yo yun. Chances are, you will also have an agreeable marriage. Pero kung yung parents mo, medyo hindi magkasundo, ayun.
Okay, siguro, please give your advice to those who are in a situation where the parents are always fighting, nangangaliwa yung mga, di ba, yung sa family normal, pero gustong magbago nung bata or nung young adult. What does he have to do? He wants to break away from that family mode.
In the first place, the young adult, without his fault, without his intending it, suffers. No, naghihirap siya, maaari siyang mag-depression, maaari siyang mag-anxiety, maaari siyang mag-absenteeism. Not complicated. By complicated, I mean, hindi just because of his studies or his work. It's complicated by issues of the there and then. How unhappy his parents were. No? Dala-dala niya yun eh. So he has to live through that. Whatever crisis, challenges he undergoes, he has to live through that. But at the end, ultimately, he cannot blame anyone. The important thing is acceptance. Number one, accept mo. Ganyan si Papa, ganyan si Mama. No? Wala ka nang magagawa. Tsaka kailangan maintindihan mo what the effect was on you. You need insight. No? You need insight into finding out, learning how those incidents, bad relationships in your past, affected you, how they impinge on your choices, on your attitudes, on your style in relating to people, on your hang-ups, on your issues. The best way, kung may ganun kang baggage, is to go to psychotherapy yourself. No? Minsan, kailangan mo talaga eh. That's the best way to develop insight. Makonect-connect mo yung nangyari sa buhay mo, kaya ka ganyan, kasi ganito, no? Kaya mo ginagawa to, kasi nangyari to nung bata ka. That's the best way. Only if you have insight can you actively, willfully divert from where you've been.
Okay. So
pero kung wala kang insight, you tend to repeat.
Pasukin natin ulit yun kasi medyo mabigat yung binigit mo the last few lines. Ang pagtulong dun sa mga nagkakaroon ng problema through psychotherapy is, to simplify it, iintindihin niya kung nangyari sa nakaraan, more or less.
I-connect niya.
Pagko-connect niya kung bakit ganito si Papa, ganito si Nanay, ganito si Tio, ganito si Lolo.
Correct.
Pagkatapos pagka na-discover niya yun at natanggap niya yun, then he can move on or move forward. Correct.
It's important to note that this is only minority of people. Yung mga nagkakasakit, let's say one-third of the population. The other two-thirds are let's say normal. I hesitate to use that term, no? Parang ordinary, happy enough families. Wala naman masyadong baggage. Those are two-thirds of the population. Hindi kailangan ng psychotherapy. It's a matter of degree. Yung challenges natin nung bata tayo. Yung mga tinatamaan ng ganitong problema requiring psychotherapy in their late adolescence or early adulthood, this is only about 1/3 of the population. The other 2/3 lived more or less ordinary versus normal. I don't want to use the word normal kasi lahat naman ng tao may sariling challenges. But ordinary, uneventful, if there's such a thing, no? It's a matter of degree yung mga difficulties na naranasan natin nung bata tayo. The trauma, the pain, the suffering that the 1/3 have experienced. The other 2/3 are not free, are not exempted from that. Meron silang sarili nila. It just so happens yung 1/3 medyo mas matindi yung mga nangyari sa kanila through no fault of theirs. These are the ones who might need at a point in their lives to go to psychotherapy. And then those who go to psychotherapy, again, 1/3, 1/3, 1/3. 1/3 get better, 1/3 remain the same, 1/3 function at a lower level of functionality. No? Yung mga gumagaling talaga, actually yung mga tinatamaan in any family, say 4 kayo magkapatid, isa tatamaan, the other 3, hindi naman tatamaan Usually, yung nagiging tinatawag na identified patient in family systems therapy. The problem is really the family constellation and dynamics. It's not the one person. The identified patient, kung tawagin, is the one who is embodying the problem of the family system. Usually, the identified patient is the one who is the smartest and the most sensitive.
Wow.
Member of the family.
Wow, naman yung pinakamagaling ang natatamaan.
Siya yung bibigay. Not to say the other 3 are not talented as well. Pero siya yung matindi.
Is it because he takes everything more seriously or he or she or talagang mas perceptive lang or anong?
That also, and family and the birth order. Panganay, second, medyo kung panganay ka, welcome na welcome ka di ba? Everything new for your parents. Pagdating ng 4th, 5th, medyo busy na yung magulang, wala na masyadong oras sa'yo. Tsaka the problems have become more deeply entrenched. Kung 4th child ka, ganyan. yun.
And so, mabalik tayo dun sa mga ibang issues ng normally yung mga kabataan, kasi you've already identified more or less yung sistema ng psychotherapy. Are there cases where you have to prescribe drugs just to cure the depression?
Yeah, there are times when medicine is really indicated. I do not do that myself, because I'm a PhD clinical psychologist. Hindi ako pwede magbigay ng gamot. But in such cases, I happen to have my wife, Dr. Encarnacion, who is an MD psychiatrist. So, pag ganun yung pasyente, masyadong agitated, masyadong depressed, kahit na kausapin mo na kausapin, talagang naging chemical na yung depression, nagbago na yung neurotransmitters, the psychotherapy will not take deep root, hindi kaya ng salita lang. So, kailangan mo pakalmahin, bigyan ng antidepressants. I refer them to my wife. Wow. Then my wife sees them, administers the drugs kung kinakailangan, and then refers back to me for the psychotherapy.
Well, I have a small gift for you. This is
si Dr.
from Dr. Sevilla. It's a gift certificate for Vine Holistic
thank you.
Clinic.
Thank you.
Pampapayat.
Pwede na magpapayat.
Anyway, just you can use it. And actually, the clinic is actually holistic. Non-surgical. So, I mean, you met her the other time.
Yeah.
She's one of our sponsors. Kaya lahat ng guests, binibigyan ko ng gift certificate dyan sa Vine Holistic. We'll be going for a break, Doc, but I'd like to ask another question you can answer right after. What about those that are bothered because of drug dependence? Kasi napaka-prevalent. Lalo nababalita dito ngayon yung problema natin sa droga. Kaya ba ng psychotherapy yung mga addict? This is Tonino Abana, Libertas, don't go away. We'll be back. Welcome back to Libertas. This is Tonino Abana with our special guest, Dr. Ruben Encarnacion, who's a clinical psychologist. For the break, I asked him, what about drug dependence? Can they still be cured by psychotherapy, or do they need other types of intervention?
There are doctors, psychiatrists, who specialize in it. Dalawa yan yung napakahirap gamutin ng psychologist. Drug dependence, abuse, tsaka personality disorders. I'd rather take the personality disorders. Ano ba yung personality disorder? Mga borderline, ganon, usually borderline. Very empty sense of self, alternating relationships between at one point, this person is the best person in the world. Next month, she's the worst person. Fear of real or imagined abandonment. Impulsiveness, intense rage and jealousy. Yun yung borderline. I've met with some success. I've had 5 borderline female patients in the past 3 years. No? Hindi sa gumagaling, pero may improvement by helping them to understand the whys and wherefores of their lives. Pero yung drugs, ang naging pasyente ko, yung misis, tsaka yung anak. Yon mas may chance ka. Pero pag drug dependent, masyadong malalim, no? Malalim na nga yung problema. Again, it's rooted in parenting. Tapos yung choice niya of coping mechanism to take drugs, worsens the problem Nag-iiba yung pag-iisip ng tao nako-corrupt yung personality functioning ng tao. So, may mga psychiatrists na addiction psychiatrists. They specialize in it. I'm not too familiar with what they do, nor with their prognosis and degree of success with the patients. Ang alam ko lang, yan ang isa sa mga pinakamahirap pagalingin. Napakahirap. In the 70s, si Father Bob Garon yan, di ba? Nung there. Pero pati si Bob Garon, naging he gave up that line. It was very,
very a lot of the cure is really isolation, they
tsaka
withdrawal.
Yung power tripping sa mga rehab na napasukan ko when I was still a student. Nagpraktiko mo ko sa isang halfway house, parang ganun. Meron silang patient, home care, na yung mga staff hindi masyadong schooled in psychology, yung ginugulpe.
Oh my God.
Ginugulpe, tapos nagpa-power trip yung mga Ang model kasi sa drug therapy, sabi nila, no? You have to be a druggie yourself. You have to be an ex-drug addict yourself to be effective as a drug counselor. Yun ang model ng drug counseling dito sa
Is
Pilipinas.
it successful pagka ganun?
Balita ako kasi alam nila yung gimmick ng mga drug addicts.
Okay.
Alam nila kung anong iniisip. Hindi sila maloko nung mga drug patients nila. Kasi alam nila kung anong yung pagka-manipulative, pagka-lying, pagka-passive-aggressive. Alam nila lahat ng tricks kung ex-addict ka. Hindi ka maluloko nung Pero yun nga, what I know naman, may kaibigan ako, nakausap ko na ganon, siya, drug counselor siya, and ex-addict siya mismo. Parang it never leaves you the knowledge, the feeling that you are constantly a work in progress. Addict ka dati. Anytime you can take it again. You can be an addict again. And the hopelessness, whatever you felt then, does not leave you. Meron ka pa ring suicide thoughts kahit na addiction counselor ka. Ganun daw. Pag ex-addict ka, you carry your goals. Of course, you have mustered enough courage and strength and will to overcome your drug habit. But the issues, the wounds, still there. They never disappear. Pati naman depression, pati naman anxiety. You may achieve a better state of functioning in your life, but then again, mas natanggap mo yung parents mo, but they never change, really, 60 na tayo. Yung parents natin, ganun pa rin. If they made certain mistakes in our childhood, they don't change, Our parents. So tayo talaga ang nagbabago. So, yun, nabanggit ko, kung nag-depression ka, nag-anxiety ka, in your youth, tapos okay ka na, the reasons remain, no? Hindi nawawala yun. We are all constantly a work of in progress. Lahat tayo, we constantly, even at 60, 70, we constantly have to keep on improving ourselves. Keep on learning new things. That's what we're called upon as human beings.
Right. What has the role of religion been in terms of stabilizing the personality of
Alam mo,
people?
when a person is depressed, suicidal, religion has nothing to do with it.
Yeah.
You cannot tell a depressed person, you pray. You cannot say, oh, you go to church. Hindi.
Okay.
It's a different, it's a different area of our lives. After your journey, na-depressed ka, nag-therapy ka, kaya sa psychologist, it's not part of our job to give religious advice, insights. No, we must not actually go into religion. But if you are a man of God, no, the patient feels it without your having to talk about it. So you, akayin mo yung patient to better modes of adjustment and wellness. Pagdating, after 2 years na nagte-therapy kayo, tumitino, gumaganda yung buhay ng patient. And then he realizes at that point, God was there pala.
Okay, that's a very interesting point. So, during the point of depression, during the point of hopelessness, pag in-introduce mo yung religion, hindi ubra.
Wala.
Pero at the point na he finds that he's already recovering, then he realizes there might have been something higher.
Parang sa Emmaus, the two men who were walking and talking, ano nangyari the last 2 days, ganito sa Jerusalem. Then a stranger came to walk with them, di ba? Ano nangyari? Kinuwento, hindi mo ba alam ano nangyari? May mamang ganito, pinatay siya, ganyan. And then they said, oh, sumama ka na sa amin, gabi na. Di ba? Let's sit to eat and he may sleep with us. Tapos, the stranger broke the bread, di ba? And lifted the chalice. And then they realized, si Jesus pala yun. Tapos nawala si Jesus. Ganon din sa atin, no? During the journey, we don't know Jesus is there. Pero pag makita na natin, pag lumiwanag na yun, realize, nandun pala siya.
What are the key factors that someone experiencing depression or anxiety should do? Is there any exercise? Is there any mental exercise that he can do? Or
the best really is psychotherapy.
Yes.
No? Go to psychotherapy. Tapos, kung hindi mo kasundo yung doktor mo sa first session, palitan mo. It takes very short while even 10 minutes, magtinginan kayo. Alam mo this is the right doctor for you.
Right.
If you don't get that in your first session with your doctor, hanap ka na ng iba. Pero kung mahanap mo yung doktor mo after the first 10 minutes, the first hour session, stick with it. No? Stick with that guy or girl. Yun na yung doktor mo.
Yeah, Doc, normally, during the point where someone is feeling troubled, these mental issues, anxiety, depression, and then it's normally amplified. The emotions are really amplified. A simple thing is multiplied 3, 4, 5, 10 times, and then he feels, he's on the verge of this nervous breakdown. So how does one avoid that situation to realize na hindi naman ganun kaseryoso yung problema?
Totoo naman when we are in the midst of our problem, there is no solution. We think. There is no tomorrow. We think.
Parang kulong-ulo na yung pag-iisip nila.
Ganun talaga yun. That's really how it is. Then, somehow, you manage, there's no going through the problem There's no going around the problem, rather. The way out of a problem is not around it, but through it. Kailangan daanan mo Kailangan daanan mo.
So, during dinadaanan mo yan, one solution is psychotherapy, the other solution is what, friends or
yung iba, dinadaan
parents?
sa inom.
Yung iba
Dinadaan
inom.
sa inom, dinadaan sa kaibigan.
Oo.
Oo.
Yung inom nakakatulong ba?
Well, to a certain extent, no? May kasama ka na, pero largely you can say na escapism 'yan eh. Na tininom mo, yung you denied your problem for a while. 2 hours kang nagsaya, gano'n. Paggising mo kinabukasan, gano'n pa rin ang sitwasyon mo. Gano'n pa rin problema mo, no? Ayun. Gano'n. Tapos if you feel that way about your doctor, no? Na punta ka ng punta, pero ganun pa rin naman ang problema mo. It may seem that way, no? At the start. Pero ako, importante yung first session is to give somehow the message of hope. If you succeed in that sa first session, may hope. No? Okay lang to. Sige, dadanasin ko to, dadaanan ko to. I will stick with this doctor as long as I need to. Siya yung posibleng makatulong sa akin. Kung mabigay mo yung message of hope, for me, that is the primary objective of the first session. Aside from rapport, no? Rapport is important. Pag bata, teenager, dati, no, nung nag-yosi pa ako, ang rapport sa teenager, mag-yosi kayo sa labas. Instant rapport yun.
Yosi kayo pareho.
Yosi kayo sa fire escape. Eh ngayon, wala na. Hindi na ako nag-yosi. Buti naman. So wala na akong ganun sa bata. Sa teenager, 16, 18. So, there are other ways of building rapport. And yun na nga, as I said, giving the message of hope. No? You don't have to say anything. Makikinig ka lang. Really, psychotherapy is listening more than anything else.
Let's go to a common issue among the youth. Kasi maraming kabataan nanonood dito. A person that's in love, di ba? And then all of a sudden, yung process of love, process of getting jilted, then process of depression after that. What does a young man or woman go through, and then how do they move forward from that issue?
Let me open up the roots, no, of falling in love, of courting a woman aggressively, even insanely, risking everything, risking rejection, and then facing rejection. Ang root nun is nasa successful Oedipal conflict. At age 4 to 8, boys discover they are boys by developing sexual feelings towards their mom. And girls have their counterpart. They fall in love with their father. And the boys, so let's stay with the boys, during that 4 to 8 age range na love nila yung mother nila, sexually even, they wish their father would disappear. No? I've seen patients na naging sexual addicted na na lalaki, over sex, no? They have sex left and right, no? That's because the Oedipal conflict was not successfully resolved. Successful resolution means you will not win your mother. Your mother is your father's partner. So you get reassured about the sanctity and solidness of their union when the mother does not respond to you, of course, appropriate ang response, and your father is adequate. Kung weakling ang father mo, parang kayang-kaya mo yon ang feeling mo, unconsciously. Kung overly aggressive ang tatay mo, castrated ka. Like some personages we know in media, no? Yung mga sobrang macho effect. Those are castrated men, no? Exaggerated manhood. Tapos, pag ma-successfully resolve ang Oedipal conflict, that teaches the young man many important things. Ma-successfully resolve nila yon at 6, 8, boys stay with boys at that age, 6 to 12, no? Walang sexual yon. Kasi na-resolve nila yung Oedipal conflict nila. Girls stay with girls, boys stay with boys from age 6 to 12. When the hormones kick in and we hit puberty at 12 to 14, that sexual energy is directed outside the family. Hindi na sa loob. Kaya nagkaka-incest, unresolved sexual Oedipal conflict. Tsaka later conflicts, mga lalaki nga na oversex, lalaki na exaggerated macho. Yun ang nangyayari. Pero importante, the important lessons, invaluable lessons of overcoming or resolving the Oedipal conflict successfully, you learn to love. You learn to risk everything. You learn to love with abandon. Yung manliligaw ka, okay lang na ma-reject ka. Kasi na-reject ka na minsan. So willing ka to take risks. Isusugal mo kahit ka mabasted. Basta mahal mo tong taong to. Liligawan mo. You will pursue. We learn to do that because of a successful Oedipal conflict resolution.
It's the first time I...
If you don't remember your Oedipal conflict, that means it was normal.
Okay.
If you remember it, that means something went wrong.
Okay. What about for women?
Yun, yung crush nila sa father nila.
Okay.
Yung mga controversial, yung masyadong mahilig sa UAAP.
Okay.
na women, masyadong mahilig sa
watching young
basketball
men.
Players.
Okay.
Idipal yun. Idipal yun.
Ako, ang bilis ng panahon. I think we discussed so many things. Ang daming tanong ng mga televiewers natin. Unfortunately, we cannot accept texts or calls right now because this is a taped message or a taped show. But I think dahil sa dami ng pinag-usapan natin ngayong gabi, binigyan natin sila ng mga bagay-bagay na pag-isipan, di ba? Doc Encarnacion. And at this point in the show, dahil malapit na matapos, I'd like to give you this opportunity to greet anyone or to give your parting message to our audience.
If you're interested in seeing me, talking to me, see my website, www.rubenencarnacion.com. And hindi ko ginagawa to, pero batiin ko yung mga anak ko, si Ana, si Daniel, si Carlos, si Luisa, tsaka yung apo ko.
Pwede ba silang makakuha ng telephone number kung saan ka pwede tatawagan kung may issue sila, kung may problema, o gusto makipagkita sa iyo?
Yung cellphone ko nandun sa website ko eh. That's all you need to go. No, my cell phone is public, no?
Okay.
Nandun sa website ko. You can get to me directly. Wala akong secretary. You can call me directly. That's all right.
Baka pwede mo sabihin yung cellphone number mo para ano?
0917-891-2331.
Okay, one more time para makakuha ng mga...
0917-891-2331.
Okay.
Ang inyong lingkod, Dr. Ruben Encarnacion.
Napaka swerte natin at nakapanayam natin si Dr. Ruben Encarnacion. Ang dami siyang binigay na words of wisdom. And so I'd like to, on behalf of the show, thank you so much, Doc Encarnacion. And this is Libertas, Tonino Abana signing off. Good evening and thank you.
Thank you, Tonino.